in Texas predominantly use abstinence-only programs to provide information about sex to the students. Abstinence Only directs its services to serve youths in grades 1st through 8th in counties that have a birth rate that exceeds 45 per 1,000 females, ages 15 to 19. Abstinence-only programs encourage students to remain abstinent till marriage. These programs inform students about the risks of engaging in any sexual intercourse, such as high pregnancy rates and STIs among students all over the country.
Abstinence education only is when you do not have sex at all or anything that's kind of related to sex, so you're not tempted toward it, and usually that's kind of directed more towards the whole purity thing and the whole like you have to wait till marriage. That's kind of what I always related it to more.
According to the Texas Department of Study Health Services, the goal for the abstinence-only education program is to delay initiation of sexual activity as part of a continuum of services to decrease the teen birth rate and rate of sexually transmitted infections in youth ages 15 through 19. The program recommends a holistic approach to address adolescent pregnancies and STI prevention with a target on early interventions, focusing on risk and protection factors that affect early initiation of sexual activity.
Let me ask you another one here on a different topic. Governor, why does Texas continue with abstinence education programs when they don't seem to be working? In fact, I think we have the 3rd highest teen pregnancy rate in the country among all the states.
Abstinence works.
But we are the 3rd highest teen pregnancy. We have the 3rd highest teen pregnancy rate among all states in the country. The questioner's point is, it doesn't seem to be working. Abstinence education.
Based on research, abstinence-only programs do not seem to be working in Texas. According to the National Vital Statistics System, Texas is among the 10 states with the highest teenage birth rates. As a matter of fact, it is the 3rd highest in the nation. Adolescents in Texas between the ages of 15 through 19 have a higher pregnancy rate percentage alone than the United States combined. Every 10 minutes, a teen gives birth. Every 48 minutes, a teen has an abortion.
It definitely didn't work because at my high school, about 10% of the girls were pregnant.
Now I don't think it works at all because there's peer pressure, and then they start seeing that, you know, well, my friend had sex and they said it was okay, nothing happened to them. Maybe if I try it, nothing's gonna happen to me. And it's kind of just been a rolling on thing that it's really hard to find any teens that do not have sex. So it's just peer pressure that kind of broke down the barriers, and abstinence really doesn't work. I always say that the best way is to educate what can happen, how you can prevent it, and the fact that the individual needs to have an open mind, because just if you don't follow these things, like you can fall under it, but at the same time you can't, but the best way is to educate.
Comprehensive sexual education programs promote abstinence as the most effective way to prevent teen pregnancies and sexually transmitted infections, while also teaching accurate and age-appropriate information on healthy relationships, contraception, and STIs. Providing this information to adolescents allows them to make responsible decisions about sexual activity. Students in comprehensive sexual education classes do not engage in sexual activity more often or earlier, but do use contraception and practice safer sex more consistently when they become sexually active.
I really don't think it encourages you to have sex because you start seeing like what can happen and what it can lead to. So if you're educated, that can either A, prevent it, or B, you know, you're educated on how not to receive any of these diseases or to get pregnant.
Nobody is out there advocating children going out being sexually active. But if they choose to be sexually active, we want them to make responsible decisions. You know, our government now, you know, well, condoms will break. That's right. Yes. Condoms will break. But there's no question that the vows of abstinence break far more easily than those latex condoms.
That's
so
true.
we have to be about protecting our children.
Yes, I think by all means the government should invest more money in education because I don't think they invest as much as they should.
In 2010, sex education programs in Texas received a total of more than $7.4 million in new federal grants.